Patients with multiple myeloma can be treated with a variety of treatments. These include chemotherapeutic drugs, therapeutic monoclonal antibodies, and stem cell transplant. However, when patients are treated, they must be monitored so that the clinicians know that the treatment is working, so they can change the treatment if it isn't working, and also to detect relapse. This is when the underlying tumour ceases to respond to the treatment and begins to grow again. The International Myeloma Working Group produced guidelines for multiple myeloma and related diseases such as smoldering multiple myeloma, monoclonal gammopathy of undetermined significance, and AL amyloidosis. Multiple myeloma is a blood cancer. In multiple myeloma, the cells secrete monoclonal protein, and the amount of monoclonal protein found in the blood and urine is correlated to the number of tumour cells in the underlying cancer. Therefore, you can monitor this monoclonal protein to monitor the underlying tumour. According to the International Myeloma Working Group guidelines, multiple myeloma patients should be monitored using serum protein electrophoresis and urine protein electrophoresis if the amount of monoclonal protein that a patient produces is enough to be measurable by these two techniques. If there is not enough monoclonal protein produced to be measurable by serum protein electrophoresis and urine protein electrophoresis, serum free light chain testing may be used, again provided that there is enough monoclonal protein to be measurable by serum free light chain testing. Even in patients who are measurable using serum or urine protein electrophoresis, serum free light chain testing should be performed occasionally to detect a form of relapse called free light chain escape. In free light chain escape, a patient who produced intact immunoglobulins at diagnosis only produces free light chains when they relapse. Measuring serum free light chains enables this form of relapse to be detected. If a patient is negative by serum and urine methods, a bone marrow biopsy is performed in order to detect minimal residual disease. Everybody is looking for ways to reduce bone marrow biopsies because they're painful and invasive, and techniques are being worked on that will use serum or urine measurements instead of bone marrow biopsies to detect minimal residual disease. The IMWG guidelines enable better patient monitoring and earlier detection of relapse, which enables the patient to be treated again either with the same treatment they originally responded to or with new treatments. Together, this means there is better patient care.